This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.
Good evening. I'm Joe Sam Robinson. It's my pleasure to have with us tonight Dave Borghelli, who is the head of emergency medical services at the Houston Healthcare apparatus. Is that correct? Did I get that right?
That's correct.
Good. Well, it's a pleasure to have you here tonight, and we're going to talk a little bit about emergency care in this part of the world. So, Dave, you've come to this part of the world from California. Can you talk a little bit about your journeys that brought you here?
Well, thank you. First of all, thank you very much for having me on, Dr. Robinson. And that's correct. I come from California. I come from the Bay Area, where my journey through emergency medicine began as a firefighter and a paramedic. I worked in fire departments and ambulance services, and I was even a flight medic on a helicopter before I journeyed into management of emergency medical services. At about 5 years ago, I was contacted by Houston Healthcare asking if I would like to come across the country to come and run their emergency medical services and emergency management for the two hospitals and ambulances of Houston County.
Well, that sounds like quite a journey through life. Maybe you could discuss what it was like to be trained as a firefighter. I mean, that must be a pretty daunting experience. Did they put you in the middle of flames, and what was that like to do?
Well, they definitely don't put you in the middle of flames on your first day, but definitely prepare you for when it's time to do that. It's for being in a military town, most folks would be familiar with the boot camp type atmosphere where there's a lot of physical training, but also a lot of didactic and different sciences to learn the behavior of fire and building codes and such to prepare you for.
Wow! So you've had quite an experience. You've done that, and then you sort of were a frontline guy on ambulances. I mean, you're actually out there rendering emergency care in a real life setting. Is that correct?
That's correct. In the 80s, I went to paramedic school.
Yes.
And learned advanced life support and worked on an ambulance and also on fire engines in that role.
Yes.
Where saw quite a bit, both medical and traumatic, and saw the best and worst of people in many different situations.
Well, I'm sure you have some war stories we might be able to extract from you, but we'll see how that goes. It's certainly quite things can be very challenging in those circumstances, and so that your experience, I'm sure, has served you well in your present position. And you've arrived in Warner Robins 5 years ago. Is that right? And you have a family. You have some kids. And
I do. I'm married, and I have two daughters.
Well, why don't you tell me their names?
Okay. My wife.
So you can tell me your wife's name too.
Yeah, my wife's name is Jerry, and my daughter's Kayla, 15, and Paige, 11, and they follow my career. At least they tell me they do. But I'm more interested in their journey through the world, and actually both of them are interested in the medical field.
Well, great. So you've made a home in Houston County, and you have some very responsible tasks now. And we've had a lot of discussion, I guess, on our show here about some of the issues involved with trauma, emergency care. Maybe we could just talk a little bit about what the situation is like in Houston County these days. And there are 2 hospitals in the healthcare network for the Houston County Hospital Authority. Is that correct?
Well, for Houston Healthcare, we have 2 hospitals.
Yes.
We have Houston Medical Center here in
Yes.
Warner Robins,
Yes.
a 237-bed
Yes.
hospital.
Yes.
And then we also have Perry Hospital in Perry, and
Yes.
that's a 45-bed hospital. Each hospital has an emergency department.
And so is it all coordinated together? You sort of try and the 2 hospitals work together, and the emergency apparatus is sort of put in the same, I guess, arrangement? Is that true?
Absolutely. I mean, but the leadership of Houston Healthcare manages both hospitals, but one being a large hospital and another being
Yes.
a smaller hospital. There's some unique differences that each locale addresses with emergency medicine. I think what's a good thing that ties the 2 together is Houston Healthcare has its own ambulance service, and we work side by side with each of the emergency departments.
So you have, now, have the number of ambulances expanded, and how exactly does that work? Let's suppose you're watching the show and something happens and you need emergency care. Can you just sort of go through that? The person would call 911. What's going to happen then?
Sure. If a person's having a medical emergency or a traumatic event, say the person's having chest pain.
Yes.
First of all, if they're having chest pain, they should recognize that as soon as possible. One of the symptoms,
Yes.
unfortunately, of a cardiac event is
Yes.
denial.
Yes.
If you recognize that you are having
Yes.
having chest pain, you should call 911.
It's not anything to play around with, is it?
Absolutely
Right,
not.
right,
And the
right.
reason you call 911 for, say, somebody who's having chest pain is, as the responders who will respond can immediately decide if you are having an emergency and be able to treat that before damage is done.
Yes.
The first thing that'll happen is the first responders may arrive.
Now they're going to. You're going to have. You have how many ambulances do you have altogether?
During our peak hours, we
Yes.
have 9 ambulances staffed with
Yes.
paramedics and,
Yes.
and emergency medical technicians. And then during the lee hours to the middle of the night, there's 7 ambulances.
So that's a
on
pretty
duty
substantial
staffed.
number of ambulances. And so the call is going to go to 911, and then it's going to be relayed to your shop.
Absolutely. The 911 center will, quote unquote, dispatch
Yes.
the most appropriate ambulance, typically the closest ambulance to your emergency.
Yes.
When the ambulance arrives, depending on what your emergency is, firefighters may also arrive too to assist.
Yes.
Some emergencies require additional hands.
Yes.
When the paramedic and EMT arrives, they will assess your emergency, and then they may treat you on the scene, say with oxygen or splint an injury,
yes.
or start an IV, and may give you medication.
And
on the
they're
scene
trained to do this, so
stabilize
they've been through a substantial amount of training. They're going to render that first responder care. And then what's going to happen next? Where is the afflicted patient going? I mean, what's going to occur?
Well, depending on what your emergency or what your ailment is, will determine which hospital you'll go to. We always want to take you to the most appropriate hospital the first time,
Yes.
every time.
Yes.
So depending on what, and that may or may not be the nearest facility.
Yes.
Circumstances will help us decide on this. If you're not having a life-threatening emergency, we may want to take you to where your physician practices.
Yes. Yes.
Or if this is an emergency, we might want to take you to someplace with specialty care.
Yes, yes.
If you're having a serious
Yes,
trauma,
yes, yes.
we may, rather than take you to the nearest hospital, we may
Yes.
take you to the trauma center. If you're having a cardiac event where we think you're
Yes,
having a heart
yes,
attack,
yes.
we may want to take you to a hospital with a cardiac lab.
Now that's an important battlefield decision, is it not, as to where to take the patient. If the patient goes to, I think this is the way it works with our American healthcare system, if the patient goes to an emergency room and that hospital cannot look after that patient, then the patient is going to will have to be transferred somewhere else to a more tertiary kind of facility. And if there's no room, if that hospital is on diversion, there could be a substantial problem, could there not?
There could, and that happens, we see that quite a bit in some of the larger metropolitan areas. I'm very familiar with
Yes,
that happening
yes,
in
yes,
California
yes.
with the diversion status. You
Yes.
see that quite frequently in
Yes,
Atlanta,
yes.
and sometimes even in Macon. One of the good things we've kind of started to alleviate that
Yes.
with here in Houston County with Houston Medical
Yes,
Center
yes.
is we've opened the new tower and expanded our beds to the 237 beds, which
Yes.
has alleviated the need to divert emergency patients.
So that's been very useful, and I think there are lots of ways to try, and there's a lot of attention in emergency health care to try and process patients in an effective way, and then have the beds available to take care of whatever comes along. And there have been efforts like that, I think. Is that correct?
Absolutely, and that doesn't necessarily even, I mean, it does occur in life-threatening emergencies, but it's also assuring that first and foremost that we educate the public that they're seeking medical care in the right
Yes,
places. When you are having a severe or moderate
Yes.
medical emergency,
Yes.
yes, you should be seen in an emergency
Yes.
department. But sometimes if you're having, say, flu-like symptoms or a
Yes.
minor injury,
Yes.
you may be better off seeking your care at an urgent care center or a med stop.
Yes. Now, one of the issues that, I mean, I'll ask this question, is the system ever abused? In other words, does someone maybe think, well, it's going to be a big wait to have my colds treated if I go stand in line in the emergency room. I'll just dial 911 and say I have respiratory distress, and then I'll be able to get right to the head of the queue. Does that happen? And I mean, if so, what does that mean exactly?
Well, actually, you bring back some memories of the days when I was in the field and
Yes,
actually
yes,
treated
yes,
patients. And we would have folks who unfortunately would call 911 thinking that
yes.
being that I'm coming in by ambulance,
Yes.
you know, I'm going to be seen
Yes.
before others.
Yes,
Actually, that isn't the way it works.
yes,
No matter who you are,
yes.
we always determine in an emergency room
Yes.
who's to be seen
Yes,
first
yes.
by the severity
Yes, yes.
of your condition. And that's what we call triage. You may
Yes,
be familiar
yes.
with triage.
Yes.
Folks who used to watch MASH, for
Right,
example.
right,
And,
yes, yes.
and we use that same type of sorting of patients to determine who needs to go first. And it's not necessarily the person who arrives first.
So the person that's brought in with the head cold, I mean, it would be sorely disappointed after the ambulance ride to just have to wait like anyone else. Is that fair to say?
Well, that's true. You might think that's unfair, but if you say the next person to come in is a good friend of
Yes,
yours
yes.
and they're having a heart attack,
Yes.
I'm sure you would want to
Of course,
have your
of
friend
course.
seen before yourself.
So the triage is still, so if someone attempts to use the ambulance to jump the queue, I mean, it's just not going to work. Is that, I guess that's the
That's
conclusion.
it.
And you, in the course of, how busy are you guys? So in the course of a 24-hour period, you have those 9 ambulances. How many calls would you answer in this?
Well, it's never the same
Yes.
any day.
Yes.
You can have days when there's maybe where we might only transport 50 patients.
That's a pretty big number.
Countywide.
50. Wow, that's a big number.
But
Yes.
you know, there can easily be a day where there's 100.
Wow, that's a big number. And how many of those cases or patients would you say directly went to the Houston County Medical Center?
I'd say the majority of the patients that we see on
Yes,
our
yes.
ambulances are transported either to Houston Medical Center or to Perry Hospital.
Yes.
However, you see a smaller percentage, say 5 to 10% on a given day,
Yes.
because of their condition or the choice of the patient, may want to be transported to a hospital outside the county, which could be one of the 3 hospitals
Yes.
in Bibb County.
Now, there's a substantial amount of collaboration that goes on, as I understand it, between local hospitals in emergency settings. And I think you mentioned sometimes you've helped the folks in Bibb County when they've had problems. And I mean, in an emergency, everyone is mobilized. Can you talk about that as to how that works?
Sure. We divide our state and all the emergency medical services into regions. Our emergency medical service here at Houston Healthcare is part of Region 5. And what we do is we collaborate with the 23 other counties' services to have to discuss mutual needs and the ability to help each other when in need. And we've all signed a mutual aid compact should the need arise. We'll assist other counties
Yes.
when they're, when they have been depleted
Yes,
because of just more calls than anticipated. We go frequently into Peach County and into Twiggs County to assist on auto accidents especially, and Bibb County. And then if there's a large emergency, a bus accident, some of the things like the tornadoes in Bibb County, on Mother's Day, we respond to those also along with the other services. And frankly, if we were ever to be in need here in Houston County, we could expect that sort of support too from outside the county.
And this may be an apocryphal story, but at least I've heard it, that at when 9/11 occurred, that there was at least some plan to transport, if there'd been a lot of casualties in New York, to transport some of them to, via Air Force transports to the base here to have care rendered locally. Have you heard that story? And
I have.
I'm not sure I'm not sure about it, but I've certainly heard it in several points.
Right. There are
these emergencies could happen.
For large scale nationwide type emergencies to transport patients to hospitals outside the emergency area. Good example of that occurred during Katrina. Where all the hospitals in the New Orleans area were put out of commission and patients were transported out of state, and we saw quite a few of those here in Georgia. Most recently, we had the earthquake in Haiti, and patients were first evacuated to Florida, and then once Florida was at capacity, we started to see patients flown into Dobbins Air Force Base in Atlanta, and if it had become even worse, we could expect patients too.
So one particular twist of the emergency care system here is the presence of the Warner Robins Air Force Base, and that always brings up the possibility of additional missions that might be necessary on a local basis. Certainly, that could be possible.
Sure, and little thing that it happens every day at Robins Air Force Base. There's a large population of workers. We have medical emergencies on base, just like we do out in the county. And in fact, we do have an ambulance on Robins Air Force Base to care for those patients and to transport them to Houston Medical Center.
Now, maybe we could discuss a little bit of some of the impressive technological changes that are occurring in rendering emergency care and ambulances. I think you're getting 12 lead EKG possibilities now. Is that right? And
that's correct. We now have 12 lead EKGs. This is a step up from what paramedics had traditionally done in the past, where what we called the 3 lead EKG, where a paramedic could recognize electrical abnormalities of the heart and be able to treat those. But what they really couldn't see with that 3 lead was the whole picture of the heart to determine if a person was having a heart attack. We now recently here now have that capability where the paramedic can recognize that the potential for a heart attack going on in real time, consult with the physician at the emergency department over the radio. After the physician also looks at the EKG, determine if the patient would be better in an emergency department or in fact be transported to a cardiac catheter lab.
Now that's a rather important issue. So when the EKG is taken, does the physician in the emergency room have access to it? Is it described over the radio, or how does that work too?
Actually, they do. First the paramedic will look at the EKG, and then they'll transmit it by cellular technology from the monitor to to the computer
Yes.
that the doctor has access to. They'll do an interpretation. They may consult with a cardiologist
Yes.
to determine where best to transport the patient from the field.
Now that's a rather, I guess, daunting situation a lot of times. When there's acute cardiac ischemia, we're going to get substantial, dangerous, life-threatening arrhythmias, and how is that dealt with if this is picked up in an ambulance environment?
Well, first of all, recognizing that what we want to do, the most important thing is to get oxygenated blood back to the heart. What happens in a heart attack most of the time is blockage of the
Yes,
coronary
yes,
arteries.
yes.
And what we want to do is get through that blockage so the oxygen will get
Yes,
back.
yes.
And that's usually done by a cardiac cath.
Yes.
Special centers are
Yes.
able to do that, and we want to do that within what we call within 90 minutes.
Yes.
If we can reperfuse that heart within 90 minutes, the likelihood is we can save that heart from injury.
So this is one of the most important things, I think, in trying to put a useful nationwide and statewide and local emergency apparatus together, because we can do so much good if we can catch this disease process early on, after the heart attack has been completed and a lot of myocardium has been destroyed. It's too late, and if we can get there soon enough and start treatment soon enough, a substantial amount of myocardium can be saved, and the patient can have a much better life. And so you're constantly trying to get there sooner and get the patient to the right place. Is that right?
That's correct, but like I mentioned earlier, though, I think the most important part of what we call the chain of survival is you as a patient or a family member recognizing with another
Yes.
family member
Yes.
is that a person could potentially be having a heart attack,
Yes.
and to seek help immediately.
So in your experience, it's quite common for some of our crusty citizens just to sort of dismiss this as indigestion. Is that a common story?
Absolutely, they're having indigestion, or they're just I'm just having a twitch, or it's a muscular
Yes,
type
yes.
thing. But one of the recognized symptoms of
Yes.
a heart attack is denial that
Yes,
anything
yes,
is wrong.
yes.
And once again, education of our
Yes.
citizenry is important, and learning your own body
Yes,
and learning
yes,
that something
yes.
is wrong is important.
And your team is ready to help, and you can get ambulances in Houston County where they need to go pretty quickly. Is that do you time this, and how long does it take?
Absolutely. Depending on what part of the county.
Yes.
Clearly,
Yes.
we're going to be on scene much quicker
Yes.
in Perry or Warner Robins than we are, say, in
Yes,
Elko.
yes, yes.
But we do what we call system status management. We look at historical data
Yes.
to determine where best to position our
Yes.
ambulances ahead of time
Yes.
to meet the greatest need to be able to respond quicker to any emergency. Now, when we have some ambulances who are already treating patients, we will redeploy
Yes,
our ambulances,
yes.
so we're not leaving holes in our deployment
Yes.
system, so we can continue to be able to respond in the quickest amount of time.
Yes, and if I can use a big word, I'll call this a cybernetic loop. In other words, you sort of have a self-correcting arrangement. So if you discover that the situation hasn't been optimally dealt with, you try and correct it, and you're constantly trying to put together a better service. Is that right? And
Absolutely. In real time, we have
Yes.
dispatchers
Yes.
and supervisors who monitor these trends to
Yes.
redeploy the ambulances. But over time, we'll look at data
Yes.
and conjecture through various stakeholders, such as the physicians,
Yes.
the fire departments,
Right.
and to determine if we need to change plans to redeploy where we have ambulances. Have more ambulances in one
Yes,
locale
yes.
than another, and adjust that way.
Another problem that frequently appears, I think, in the community are people that have strokes. And maybe you could talk a little bit about that. When people you mentioned the importance of understanding when the when there's a true heart attack, when people are truly having a stroke. Can you speak to that? I mean,
sure, and actually this is one of the most exciting things that I've come across in a while in emergency medical services, is being able to head off a stroke.
Yes.
Most people have either have a family member who's had a stroke or maybe know someone has had a stroke, and those could be quite debilitating.
Yes, yes.
And if we can stop that process as quickly as possible, we could save that person and that family quite a bit of suffering over a lifetime.
Yes.
So what we are now developing protocols to recognize quickly that someone's having a stroke and get them to the most appropriate facility to deal with that stroke.
And there are lots of things that can be done. I think the crucial issue is time. So if it's possible to get a patient to the appropriate setting quick enough, then we can really reverse that. And certainly in regards to the brain, it's an exquisitely sensitive organ to anoxia or lack of oxygen. It doesn't do well if there's any delay at all. But now we have technology that's out there that's proved to reverse these problems. So that's an important issue. Now we have just a little bit of time left, and maybe we can discuss the recent election that occurred when the Proposition number 2 was defeated. And I think both of us can say we supported that proposition. And the people have spoken, and actually it's interesting in Houston County by a great majority, people didn't think that was the right way to fund the trauma system by the license tag fees. Do you have any comments? I mean, how useful would it have been? What do you think about that?
Sure.
On the Houston County.
First of all, once again, I was, I also supported Amendment 2, which would have added a $10 surcharge to your to the tag fee to augment trauma care in the state of Georgia. And being that I'm not a big tax person, it's a very difficult choice to support a tax, but I did support this one wholeheartedly. One of the challenges by not having that revenue stream now is you're not, and especially in this economic climate, you're probably not going to see more trauma centers in the state of Georgia in the near future. And in fact, there is quite a worry now about continuing to have strong trauma centers. The existing ones continue in the status that they are now. Just in the past 2 years, in the state of Georgia, we've gone from 20 trauma centers down to 16. Because of funding challenges.
Well, that's a substantial problem, and I think we have to respect the opinion of voters. I mean, they didn't think that was the right thing to do, but 1.2 million people in the state did vote for this, and I think it's going to be it'll be a very useful thing if additional funds can be found from some other source to assist the trauma network. I have to say that I think it's going to be rather difficult just in general for the state to do that because of the difficult economic circumstances. But I think it should be remarked upon if we can save someone's life or restore them to the family. It's a good economic decision. And actually, the relatively small investment in putting the trauma apparatus, which really encompasses all emergency services. It's one big, huge juggernaut there. If we can put all that together, that would certainly be a big step forward. And I don't think it's time to give up hope yet. Would you agree with that?
No, I'm not. I'm not giving up hope. I'll be here supporting trauma services as long as I'm around. But we're going to need to take other steps to try to find those revenue streams. The first thing we need to do is speak with our folks in the legislature to look about how we can divert the existing monies towards keeping these trauma centers open. And we got to remember the trauma system isn't just the trauma centers. It's also educating our first responders who arrive at the scene to make sure they have the training and tools they need to be able to treat the patient at the scene. It has to
Dave, thank you. But I think we've about run out of time. You're doing a great job. Keep up the good work. I'm proud of the job you're doing.
Okay, thank you very much.
Thank you.
This program is brought to you by the Georgia Neurosurgical Institute. For over 50 years, rendering neurosurgical care to patients of all social conditions, treating complicated problems involving the brain, spine, spinal cord, and peripheral nerves, endeavoring to encourage quality care, medical research, innovation, and education on a local, national, and international basis.